So left ventricle. Above the left ventricle would be the left atrium. You can see a little bit of the pectinate muscle on the left atrium, okay? A little bit more on this side. So that large opening would be where all the pulmonary veins were lopped off. So if this is the left ventricle, between the left atrium and the left ventricle, we have the left atrioventricular valve. Here would be the other leaflet, here, attached by chordae tendineae to the papillary muscles. And this irregular, these ridges here would be the trabeculae carni. Okay? Now, leaving the left ventricle is the aorta. And that has semilunar valves. So we can confirm that these are semilunar valves because they have no chordae tendineae attached to them. And we have two reasons to confirm that they are aortic semilunar valves. One is the vessel leaving the left ventricle. And two, you can see an opening for a coronary artery right there and right there.
Okay.
And the pulmonary trunk doesn't have coronary arteries leaving it, okay? So that's left side of the heart. And then if we look at the right side, there's the moderator band, going from the interventricular septum over to one of the papillary muscles. So this is right ventricle, that makes this the right atrium, and it has its own pectinate muscle. And if we look on this side, we can see the opening for the coronary sinus. This would have been for the superior vena cava and inferior vena cava. And right there is the opening for the coronary sinus. So that right there. So that's the coronary sinus emptying into the right atrium. Okay? So right atrium, right ventricle, that makes this the right atrioventricular valve. It has chordae tendineae. So the only structure we still need to see then is the pulmonary trunk. That was aorta, and just anterior to it is the pulmonary trunk. I know it because it's coming out of the right ventricle, which is thin-walled. So to see the pulmonary semilunar valves, we'll just make a slit down here. And there are the pulmonary semilunar valves right there. So no coronary arteries, and there's no chordae tendineae, so I know that they are semilunar valves and not atrioventricular valves. Okay? So those are the structures of the heart that I want you to be able to identify. So once you know the ventricle, if you know what's associated with the left side versus the right side, then you can identify correctly each of those components. Okay?